and things have been scary. It's not getting better. It's not fully getting better. They don't have necessarily concrete answers for us. So, there's going to be natural trepidation and anxiety about having to kind of get back into the swing of things. Um, but at the same time, rent is due. So we can't just say, I'm just going to stay home forever. They're already talking about cutting the extra unemployment benefits for those who've been on unemployment. Um, you know, Jobs. We all know what happens if your job keeps functioning without you. Maybe they'll realize they don't need you. So we want to remain um, integral to our jobs so that we continue to have our jobs. And a lot of the supports are being lifted. So it's a real conversation to think about, how am I going to ease back into working? And so that's where we want to start the discussion right now. And I invite Kalia and Tamika to come back into the conversation so that we can, maybe discuss some of these points and some others that are going forward. And I want to remind you guys to please comment in the comment box, because we want to include your questions and comments in our discussion as well.
And I just want to echo that, because this is something, as physicians, and our title, Defeating Disparities, because I think as we get into this conversation, we're really going to be able to tackle how the difference may be in our community. Because we're all faced with the pandemic. We're all faced with, what do we do? What now, right? First it was stay home, then it was reopen or lifting the lockdown. So what now? But there's going to clearly be some differences, and particularly in communities of color, and how we're going to be able to move forward with this reopening. So we have the chat box open. Really welcome you all. Once again, just because I know people are still joining, my name is Dr. Tamika Blake. I'm an emergency physician. We have Dr. Kalia Johnson, who's in pediatrics. And we also have our Dr. Oguntoye, who just kind of spoke about what we're going to be talking about and all the different multifaceted ways of how we're going to really tackle the next step, the reopening, lifting the lockdown. So I just want to talk about what's on a lot of our minds, and it's school and work. The summer, we were supposed to have less cases, and that's not happening. Like, everything that was supposed to happen is not happening. When, there was a data that I would use out of the University of Washington. And I remember specifically seeing around the end of June, July, by summer, the whole idea of flattening the curve, where you had this rise in cases, you reached the peak, and then it would go down. But it has not gone down. The only place in our country that I can clearly see a difference is New York, New Jersey, like the upper north area, who did things very stringently, right? They locked down, and you all, myself and Dr. Kalia are living originally from the New York area, but we live locally in Atlanta, Georgia area. And New Yorkers are just now starting to get back out, and we've been out. And now we are paying the price, because that map is looking very uncontrolled in terms of the COVID response.
For like 80 to 85% of the country, from what we're seeing. And I think what you said is so well put. And to me, it kind of goes back to where we started at the basics when we had our first Defeating Disparities talk. And we made such a point about some fundamentals, the basics of masking, social distancing, hand hygiene, and even in our state, just going out in public on the day-to-day, there's so much variance in what you're seeing happening in with those fundamental things that we know should be, in theory, if everyone was doing them, should be getting us to a much better place. But when there's so much fluctuation, it makes it very hard. It's going to make it very hard for us to get on the other side of this.
I think also something to point out is, I think New Yorkers have been a little bit smug about like, y'all were talking about us and now look, we're the only ones who's not together. And it's like, they're not going to stay together if you guys stop doing the things that got the numbers down. That's why like every 3 days, Cuomo comes on TV, lecturing us about like, guys, I saw, why is there like a 700 person house party, going on, or why, I don't know if you guys saw in the news that there was a big concert in the Hamptons.
Yes.
It was the Goldman, and he's like, I mean,
yes. But it's that public messaging, right? And when leaders don't have fear around that, or when they take the strong stance, the scientific evidence shows us, not just the scientific evidence, we're seeing that anecdotally play out in how we're seeing other countries globally handle this pandemic and keep their rates so low. When leaders are not fearful to stand up and say, we have the evidence of what works and we need to do it. And we are going to put the expectations and standards in place to say, this is what needs to happen. It's when we ideally get to a better place of control. So for those of us who don't live in places where there's been more firmer mandates or rules, it behooves us more in some ways to be using our individual judgment around how we're going to maneuver. And that is really challenging in a context where we're dealing with fatigue. Caution fatigue is one of the phrases I see going around of eventually, after months and months of all of this caution, you get tired and it's very easy to let your guard down. And you see one person with their mask off and subconsciously you get the messaging, oh, I don't really need to be doing this. But it's when we're not vigilant, we're lapsing into those behaviors that we run into issues. So we have to figure out ways strategically to hold ourselves accountable when maybe there's not a culture of accountability where we're living.
So let's talk about school, because that is a big proponent of our daily lives, and for those that are moms, those that are teachers, I'm a mom, kids a mom. There's a lot of people that are trying to figure out, and children going back to school affect work, right? So I just want to do a little poll. Out of the three of us, raise your hand if you feel that we should not be going back to school in the fall with the kids. I know, right? This is so crazy because we were talking about this, and it's so interesting that two of us, we're all on the front line in some way. I'm the ER. We're all seeing COVID. Myself and Dr. Clea, we're like, well, we were trying to figure out how to safely put the kids back in school, and it's very odd because I've had conversations where those who are not in the healthcare field, like, friends of friends, and they're looking at me like, you want your kids to go back to school? And I'm like, yes.
And you feel shamed, right?
I do have shame because I was just reading an article about a teacher in Baltimore, scaremommy.com, who is highly concerned about it because her class size 35, and in order to appropriately social distance, she would only maybe fit 15 in the class. So it really lends to a bigger issue, and this is where the disparities come in. Because where I live, in my local area, my county schools have gone, they're supposed to start school next week. They have delayed the school opening, and they have said remote learning until further notice. It just so happens that my oldest is now leaving the public school and he's going to be a freshman in college. And then my two younger children are in the private school system, which already had smaller class size. And they're actually giving the option of remote versus in person. And we are going to attempt the in person next week. But it's scary and it's risky. We did not do well remote learning, and particularly because what I noticed was that you really needed your parent home to be, I thought, that's my personal opinion, to be successful at remote learning. And I had to go to the emergency room and see patients. And my husband and I, we own two restaurants, and he's essentially running business. So we had to have our high school senior become the academic house supervisor. He gave himself a name. And that was how we got through the ending of last year, because it was awful. So a lot of, and I'm not alone. I've spoken to some of my healthcare colleagues, and we're like, yeah, we need the schools to be open. You know, so it's, and we want it safely. So I just wanted to but there are things that have to be in place: smaller class size, social distancing. We will not be going into schools when we drop the kids off. They'll be checking temperatures. They're like, kids, parents, sorry, drop the kids and go on. You know, they're going to be wearing masks. I bought face shields for my kids. So, you know, I just want to put it out there, but they're not assembling. Their lunch will be in the classroom. They will be in small groups. So if and when there were to be a potential child that did have the virus, if you have on the mask, it decreases the fact that you would even get the virus, one, and you're not having to quarantine the whole school, because the only persons you've been around is that small 10 to 12 person class. So it's difficult because a lot of the people of color, they may have jobs, they may not be a physician, but that single mother may be working in retail, grocery store. They do not have the luxury when rent is due to stay home and make sure their child gets remote learning. I think there are certain persons who may have higher levels of education that allow them to be at home and work. Not everyone has that luxury. So I just wanted to tackle that and really get some ideas on, where we are, because there's nothing out there saying how to do this correctly.
Yeah, that's what makes it such a good conversation, is there's so much gray in it. And to your point about the disparities and the things we need to consider uniquely in our community, the reality is that there is a higher proportion of single-headed households in our community, where there might not be a scenario of an option of another individual to be at home with the kids, and or the work circumstance gives no leeway. And one of my biggest concerns in that, as a pediatrician and as a mom, as a community member, is children being unattended at home. And it's no one's fault. It's no one's fault. This is some people's reality. If you do not have the options, and we don't have proper systems and structures in place to deal with these realities, the fact is we might see more kids unattended at home, which potentially leads to more accidents, more problems. Like, we need to be thoughtful about all of this. And because there is so much gray, we work together on that and strategizing solutions. And for me, as a single mom who has been on the front lines in the pandemic, the community Y has been a lifesaver for me in stepping up and allowing for access to care for folks who don't have a lot of options. And I think we're going to see a lot more of that mobilizing at the community level to try to ensure, hopefully, that everyone is covered and accounted for in this very odd time.
I think one thing to point out is, even if you are in a two-parent household, if you're working from home, you need to be working.
Yeah.
You need to do your job. Your boss, your company still expects you to produce what it's paying you to produce. It's not pay, people are saying like, you know, it's not like your kids are teaching themselves. It's one thing, and maybe if you have like a 17-year-old, they can be given a lesson plan and maybe you check in with them periodically. But if you have, grade school kids, you're going to have to, if either you're teaching the kids and helping them or you're working, you're not really going to be able to do both. So, when you polled about whether I think the kids should go back to school, it's not like I get from a work school socialization aspect. I just don't have faith in the public health, the infection control part of it. It's just, to say, oh, well, they just have to have 6 feet of distance between them, wear masks and wash their hands. Have y'all seen children? Like, that's not what kids do. And y'all see grown-ups, they're not doing it. How many times are you out in the store, wherever, you see people crowd, as I just started it off talking about, this concert in the Hamptons with, adults who probably have, most of them even probably have advanced degrees, and they're out there, crowded up. That's not what people do. And I'm saying, and to me, I'm saying that I really think that we need to properly shut down for the 6 weeks that we should have done in March.
No.
I think we just need to, we're like, I think when you talk about the caution fatigue, people feel like we've been on caution for all these months, and I'm tired of it. And it's like, just because you're tired of Corona doesn't mean that Corona is tired of you.
Right.
Facts.
Ready. Corona has been working on her summer body. Corona is and
she's fortifying.
Corona got a 6-pack because she been getting it in.
And y'all, like, and I'm just saying that, like, as much as we're tired of it, we have to stop being tired of it. We have to remember what the cautions are, even to go back and talk about, I know one of our first conversations was on how do we properly do hygiene to prevent the spread of COVID. I think people need to be reminded of that. I think you need to know that if you're wearing a mask, wearing your mask, not covering your nose is not wearing a mask. So
I will tell you, I saw someone wearing a mask and they had pulled the mask. This is not, and I think about children. So this was an adult and they were doing every single nail. And I was like, ooh. So my child was like, oh, mommy, look. And I was like, I know, we should. We were just so flabbergasted. So if adults have issues, I didn't realize I was a face toucher till I had to start wearing a mask.
Yeah.
And I've noticed that one of my children is a face toucher as well. I used to do this a lot at work, a lot of this, and now I have a 2-master shield, so it's helped prevent. So I'm having to teach my children for preparation of whatever school learning environment they'll be in, of the whole idea, like, don't do that,
Yes.
and they have a mask, so imagine we as adults have issues. And I don't even have the right answer because, when I was reading that article about the teacher, and then I read something about half the teachers don't feel safe. And I think about loss of life, and I'm like, there's no perfect way.
There's no perfect way. The good thing is we do have some examples. There have been here in Georgia, I'm sure other states as well, several daycare centers that have stayed open from the beginning of the pandemic and very successfully have had no cases. But it is all around getting back to the fundamentals of what we're saying. Every teacher is masked. Every child is screened at the door. Parents drop off at the door. Extremely thorough hand hygiene throughout the day, HIPAA filter systems, all of the thorough recommendations in place. So if you can assure it for those basics and your child's, you feel like you've properly vetted your child's school can assure it for those fundamentals. Classroom size no more than 10. We know that that's been preached since the beginning of the pandemic. The recommendation is no gathering with folks more than 10 people in a room. And ideally with that, you're still able to socially distance. If you can check off some of these boxes for your child's school or daycare center, it might give you more confidence and faith in making the decision. And I have found in my reading professionally, but also just in my own experience of making decisions in my family, some resources are out there to help you gauge relative risk and relative risk in the school. There's a great resource, K through 12. If you just Google COVID-19 K through 12 school relative risk, it's a graphic that basically walks you through, to Dr. Ronke's point, it's not a great scenario. There's still at least a moderate risk if the burden of disease is high in your community. So we should really be thinking about, is this right if the burden is high? So that's why it is an appropriate conversation in Georgia. Public school probably shouldn't be starting because look at the way our rates are right now. So there's some basics you want to ideally assure for a low community burden, masking, hand hygiene, 6 feet. And then from there, depending on the school activities, there's different risk levels associated. Like no one should be doing band right now because that's an aerosolizing activity where there's an increased risk of spreading the virus. Singing in chorus, all of those things are like out. Contact sports, out. But outdoor play, outdoor activities, small classroom sizes, all of those have their different degrees of risk. And you can use those tools to empower yourself and become more informed of what's going to be right for your child and your family.
And you know what's interesting? I was thinking about, so my two younger, I have the resources to have kids in private school. There are so many kids where I live now in the public school system, they have no choice. That decision has been made for them and they're going to remote learn. I mean, if you have kids that are school age, and let's be real, school is free childcare. They feed you and they keep you like a 9 to 5. And now that's gone. So we are in a huge childcare crisis, right? Food security crisis. Because a lot of the children who go to the public schools, and this is very predominantly in our communities of color, get free lunch. And I will tell you one thing, you try to teach a hungry child, they don't want to hear nothing from you. Forget an adult, right? We don't want to hear nothing from us if we're hungry. So there's so much to contend with. You know, because not the average, and then they say, now you're going to have kids who are unattended, who are trying to make lunch themselves, who may potentially have an accident or something crazy could happen, like a fire. I don't know. It's just, there's nothing. And I've tried to look for resources, particularly for this issue that we all know we're facing, and I can't find it.
I think the thing we have to realize is that we are in uncharted territory. Nobody through the last when they talk about the last like similar type pandemic, that was 1918. That was over 100 years. So if you were alive, you were probably being born, during that time. Nobody for all intents and purposes, nobody has lived through
This
something like
place,
this.
that's right.
And you have to think about in 1918, the country wasn't this populated. This, you might have had a few big cities, but it wasn't that way. And people weren't traveling around so freely. You couldn't just jump on a plane, 50 times a day or a train or whatever and go and take your Spanish flu from New York to California and be there, and this is a completely different time. And I think that we are we are all we are using the information that we have to make educated guesses. And I think that we have to, we are doctors, so we learn about epidemiology, virology. We learned about things in medical school that, I think we can say, well, this is generally how viruses work. This is generally how things are spread. This is something that I can do. But at the end of the day, we all have to navigate and engage our own acceptance of how much risk we're willing to accept.
That's right.
And so, part of the reason we started this program with this Defeating Disparities is because we want to try to educate our community as much as we can so that people can feel empowered. And this is a reasonable decision and this is not a reasonable decision. This is a risk I think it is worth taking. This is a risk I don't think that's worth taking. And, all of that is the conversation that, we want to be able to continue to have with people and hope that if people have what is really as a medical professional, what is really the risk of this or that, and I think that that's a conversation that really needs to be had and realize that, at least we're here. I feel like I'm trying to give as unbiased an opinion as I can. I don't make any personal profit or something off of whether things are open or closed. And I'm just trying to talk about it from, and that's why I think even I have the difference of opinion probably about the schools, because I don't have a personal, if the kids go to school or the kids don't go to school, it really doesn't affect me. You know what I mean? So I can just look at it from well, I think it's going to make the numbers bump. And I think that the kids are going to I think that the schools are going to wind up having to close down in a few weeks after it's open. And I think it's not worth all the drama. But that's easy for me to say when I'm not the one having to try to juggle homeschool or getting them there or not getting them there. So.
Yeah, I think risk is important. I'm a huge proponent in assessing your risk. So when my husband and we made the decision that we were going to send our kids to school, to this private school that's going to have as many safety measures in place, we are a young family. That might have been different if we had a person like a grandparent in our home, which we don't. So I really want to make, as physicians, I think we're leaders, and I think there are those that are going to look for us for guidance or just something, because everyone's looking for information on how to maneuver with this pandemic. So assessing your individual risk is going to be key. So if you have those that are in an older age population in your home, sending your child to school may not be a good idea, because when I say if and when, because likelihood there's a chance that could be a potential case of COVID in an in-person setting for school, they bring that home, and most people are not masking in a home. And you're around someone who's above the age 65, I wouldn't want, you know what I mean? That doctor sent her kids to school and now my kid that went to COVID school, it brought it home to my mom and she's on a ventilator. You know what I mean? So we put the disclaimer of the opinions we have are solely ours, but you have to assess your individual risk. And some parents may have their own medical problems. They may have immunocompromised, lupus, kidney disease, heart disease, you name it, that they have been social distancing, and now putting your kid in school is going to put the parent at risk.
I think the gauging of risk is so important when thinking about maneuvering through life in general now. And just the way it talked about this relative risk for school, there are relative risk scales that are all over the internet now. Hartford Healthcare has a great one that basically like ranks 37 common activities of everyday life that you might consider doing and puts it into a risk category of very low risk all the way up to high or significant risk. And I think that like we think this way as physicians, this is how we train. It's like, what's my algorithm? What's this like, what's the scale? And those things are created for a reason. It's because when you're stressed, when you're fatigued, like everyone is in COVID now, it's very easy to make a mistake or to have a lapse in judgment. So to have these things to refer back to that are literally like tools, like, okay, I'm so tired, I can't make the decision right now. Is it a good idea for me to go to the grocery store? Can I just look at my relative risk? It's good to use tools like that to kind of figure out, how am I going to maneuver through this? How important is it for me to engage in this activity? Is it worth taking this risk?
And I think as a comment we have as a parent who is also an educator, it's not worth the risk. And I'm really beginning to understand and hear that from our teachers and our educators, who many parents are so thankful for. Because I know those last few months, I was like, oh, I miss our school environment. And it's hard. I get it. I completely understand what you're saying. And I think we're all worried about this generation, the fourth and fifth graders, you know, 10 years down the line, where there's such, whether it's the dropout rates, the lower college admission rates, the attrition rates, we're just, but is life being lost worth it? No. So it I feel like there's no easy answer, because I hear us as physicians are like, well, maybe we could do it safely, and I'm hearing the educators saying, no, there's no safe way.
Right. Right.
And even at work, I mean, I don't even know how folks are going to do it. Some of them had cubicles. I've heard Google, they're like, nope, not till 2021. They're like,
Right.
stay home at the house, and a lot of companies who can are probably going to be doing the same thing.
And from my standpoint, I think that's where what I want to see is more community conversation, because one size does not fit all. We come from our perspective as frontline providers. We need to assure it for our children so that we could be in the hospital to take care of everyone's relatives who are coming in sick with COVID-19. So where is the community for us to say, okay, we need to have a plan for those circumstances or situation where there's no work from home option, where children need to be accounted for and have an educational plan. So I think this is our strength as Black people, Black and brown people. We are about community. This is our time in rising above the disparities to pitch in, to use our communal mindset to figure out, how do we assure it for the single parent households, the situations where there isn't an option. And when we start brainstorming and start advocating, talking to our school boards, there has to be a way to plan and figure it out safely, where you have a scenario where there is a small class size for people where there's no option. How do we make it happen? So this is the time to put our brains to work and our skills together to figure it out, in my opinion.
And we may have to do it ourselves.
We may have to. There it is.
Because ain't nobody doing it for us.
There it is.
Well, we may have to do it ourselves. We will have to do it ourselves. No one is coming, no one is breaking down our doors to come help us for real. And not for nothing, you don't want a bunch of people who are from the outside building your community the way they think your community should be. You know,
Mm-hmm.
to the point of the risk of coming to the classroom and how they need to have no more, I think no more than 10 or 15 in a classroom. That is the ideal student teacher ratio anyway.
Yes.
Actually, it's become normalized to have these 35 and 40 students in a classroom. That's not how students learn. The classrooms are overcrowded. The kids shouldn't be in there on top of each other all day. Like, that's not, the teacher can't give the attention to, one teacher can't give attention to 32 students while maintaining discipline, while coming up with lessons. That's not how education is supposed to be. But I remember when class sizes went from like 20 to 30 to 35. That happened over the course of, my schooling, from growing up in elementary school through when I graduated. I remember when schools started having to get trailer classes and all of that.
Mm-hmm. Mm-hmm.
Good thing that maybe can come out of this. If I were, dealing with, if I was a parent or if I was a teacher, I would actually capitalize on this opportunity of saying, actually, you know what? Let's get that student teacher ratio down, because y'all have been working us too hard anyway. Y'all weren't protecting us anyway. It becomes a dangerous situation. You even think about it in the hospital, that there's a finite number of patients that you can really effectively care for. And if they have they have studies on patient-nurse ratios and outcomes, and they have studies on student-teacher ratios and outcomes. And this is pre-COVID. When there are too many students for the teachers, the students do worse. And the teachers burn out faster. So maybe something good that can come from this is advocating for improving the conditions of our schools in our communities, period, particularly because we are the ones who are faring worse with respect to COVID outcomes. We are the ones that are faring worse with respect to education outcomes. So maybe we can find a good thing out of it and advocate for ourselves and make this fit our overall agenda.
That's beautifully said. I'm seeing a really awesome comment from Marcy Jones. Homeschool co-ops are an excellent idea. And I think this, if I'm correct, what she's referring to is this idea of like a pod or a micro school where you're getting kids together in small groups. And there's lots of great articles coming out about this and blogging about it. Folks basically finding a group of 4 or 5 families where you're going to gather the kids together and have a micro school where they learn together in one home and go through the virtual learning in a group. I think in theory that's excellent, and what it's also going to require is good communication, because it takes one family having a lapse in decision making or judgment and having an exposure, and then that whole pod is exposed. So good communication and strategizing. If this is our pod outside of school days, we're restricting this pod to social activities as well. We're not going to go out. These are the folks that are going to be our people until we get through the other side of the pandemic, and that helps to reduce risk in general too, and ensure for the kids learning at the same time.
I mean, I personally have come up with my own COVID social circle. Like we kind of, I mean, I have my few people who I have been like, I mean, we're realistically in this COVID situation for another year.
A year minimum, probably 2.
Right.
No.
Talking to the walls, going insane. You have to have some sort of social interaction, and what Leah is pointing out is it's exactly right. And you have to think about the people who you're around. You look at, like, are these people who, when we go out, that they're careless or not? Like, because this is like a safety, like we have a little bit of, we're in a different kind of relationship now. Like, even though we do try to social distance, we wear masks, but I know that these are people who I'm around more. And obviously, if one of them was to become COVID positive, it would be a concern for me and any other next person that I interact with. And so, if you are going to do these homeschool co-ops, I do think that within that social group, you would have to have a conversation and some universal safety precautions between you guys, and not just the kids, but also you and your different households. And also empower yourself to speak up if you see that someone is violating that contract that you guys have come up with for each other.
Now, I want to bring up something. You brought up an excellent point, because in our community, I feel that some of us are still confused or do not believe in masking.
Mm-hmm.
It really troubles me when I'm out, because our risk is everywhere, because we are now out and about and we've lifted the lock, so you can go to multiple different businesses, supermarkets. And when I see someone without a mask in public, particularly in a state that I'm in Georgia, where we are a hot zone, right? And I'm just so confused by it. You know, I've come in contact with people that told me this was a governmental scam, you know, and I'm like, what part of the virus that is spread via respiratory droplet transmission is a scam? Like, I believe we just had a former presidential candidate, Herman Cain, who was local. I didn't even know he lived in the same county I lived in. He just passed away of coronavirus, and I believe he was at events or political gatherings not masking. No one's saying you don't. I don't believe we should still be at staying home completely, but we'll just
Right.
wear a mask.
Wear a mask.
Why are we still confused?
It goes back to the basics.
It bothers me that it's even when people are like, well, do masks really stop anything? It's like, can you use common sense? When you were growing up, did your mom tell you to cover your mouth when you sneeze? Grow up liking people talking over your food? Do you want, like, if I came, all these same people who think that masks are useless, well, let me come sneeze in your face and let me see how you'll feel about it. You won't,
Sure.
because it's like, come on, guys. Like, you don't have to have a PhD to recognize that if something, even if you want to call it, if you want to just say that it's a cold or a flu, if 3 years ago someone told you they had the flu and then they came in the room coughing around you, you would be like, what are you doing? Get out of here. Cover your mouth.
Right.
So we're just asking you to use your good common sense. Like, I am just too through with still having a conversation about, do we really need to be wearing masks? Yes.
That's right.
Let's say it
That's
again.
right.
Yes, yes,
That's
and
right.
Anyway,
yes.
like, we're not telling you to do anything that's really beyond what is good common sense. Should you be in a big old crowd with a bunch of people who could be sick? No.
Yeah.
Come on.
And there are people who've gotten coronavirus, and they said, I guess they're saying that they are immune, which I have not read any medical journal that says you are immune once you've gotten coronavirus. I've read that you have an antibody response, but that does not equal immunity. And you're walking around with no mask because there's like, oh, I had it already.
Mm-hmm. I think you both are bringing up very powerful points that get to some fundamental realities. The fact is, the reason why this recommendation is so strong and supported by scientific evidence about masking is because I think for me it gets to a few fundamental things, basic things. One, we know we have no treatment now for this illness, right? You could think it's different with some of these respiratory illnesses that we in theory know we at least have vaccines for. We have mechanisms for handling, like flu, right? We don't tell people to put on masks when flu season starts because we have vaccine, we have Tamiflu, we have treatments that can manage it to some degree at the community level. And then the second reality we know, scientifically evidence-based, is people are dying from coronavirus, right? So it ups the ante to a completely different level when you know that there's significant morbidity, mortality risk, plus we don't have a treatment. So in terms of mixed messaging on masking, for me, there's no mixed message. It's pretty clear. These are the fundamental things that we have at this point to protect us until we can get to a scenario 1+ years from now where we have some semblance to vaccinate and treat.
Yeah, I think I want to add to that. So for the mixed messaging, it has to do with leaders, right? So I looked to New York, where a leader shut things down. New York City, particularly, very densely populated area. And we know that the science showed large gatherings or where people are densely populated, you'll have increased spread. So things have just now reopened, right? So that leader followed the science. He said, we can't have people out and about, shut it down, you know, and masking became a mandate. You know, Georgia's, I will tell you, Georgia's 1 and 2, 50% is not wearing a mask. And I believe in New York, it must be well higher than 50%. So half of the population is just like, and we are red. We are deep, not just political party. We are red as in terms of
Hot.
the virus hot zone. We are COVID land right now. And mask, but so if you want to know about messaging, when I go to the hospital, we have to wear a mask. When a patient comes in the hospital, they have to wear a mask. When a visitor comes in the hospital, they have a mask. Just think about that. So if you're looking for care in a hospital right now, 99.9% you're going to be wearing a mask. You're around other people in public. So that helps. You know, you have to, and I know in our leadership, it may be a different message, but look to who's caring for the people that are sick, and that may help with some clarity. And there is data. So, as you know, we've been taught in medicine to look at what we call evidence-based data. There's data out there that suggests if someone has coronavirus and no one has on the mask, there's a higher likelihood of spread. So the person who has it and one that does not have it can get it. One person puts on a mask, you decrease it by 50%. If both parties are wearing the mask, it's almost like 99%. Follow the science. So I'm not saying that you cannot, I mean, I'm sure, and that's that's like in a close environment for a prolonged time, you know. So if you add the additional wash your hands, social distance, that even decreases the risk. So one thing is not going to do it. So that's the whole difference between the 95 and the cloth mask. The cloth mask, you add the 6 feet, you wash your hands. You're not, you know, in large gatherings. So it all adds up together.
Sharita Jones is just bringing up a powerful point that I really want us to speak to. Of the reality in this mixed messaging that for our people, there is a significant issue of trust. And that is warranted per our history, per how we have seen realities pan out for us, particularly in the medical system and the scientific community. How much can we trust this? And I think all of us can speak to this. It gets home to the point of why we wanted to create this forum of defeating disparities, is the messaging has to come from us in some way, shape, or form. And ideally, it's in multiple ways. I love that there's been so much activism on the part of Black celebrities, speaking up on social media and all kinds of forums, talking about the importance of social distancing, masking. When Idris Elba came back positive months ago at the beginning of the pandemic with coronavirus, how vocal he was about saying this is real and we need to equip ourselves as a people to prevent this. We need to talk about it and promote the evidence. I love what you said, Tamika. Like, we understand it. We don't have a problem understanding. We are smart people. The information needs to come in a way that we can process and that we can trust for us to be able to apply it effectively in our context.
I think that was the first part of the first point that I was making about using your good common sense about if you know that this is something that is spread through, respiratory spread, then you should understand that masking is going to prevent you transmitting saliva and air droplets to each other. So it's, that's one part of you using your common sense of this is how you would protect yourself if you were around someone who was sick. And the other thing is a lot of this mixed messaging, you need to look at where the message is coming from and start asking yourself who has what to lose and who might be benefiting from what they're telling me. One of the things that we're talking about, oh, we need to get our kids back to school. And a big part of the impetus behind getting the kids back to school is for us to be able to get back to work so that we can make money for our families, right? For our households. But when you look at the people who are at the top and the wealthiest, they're not rushing to put their kids back to school. So, you start thinking, and then, they're saying, you need to go back to school, but then we need to delay voting. Or, well, that's mixed messaging. What are you really saying? Like, who benefits from what? You know what I mean? And, we have to know that we have to be responsible for our health no matter what. We know that the evidence has shown that us as people of color, if we get coronavirus, we're likely to not necessarily do as well. It's really unfortunate that, I'm not saying that this is what's going to happen, but we've heard about several politicians becoming ill with coronavirus, and the one that we finally hear that has passed away was a person of color. I'm not saying that it has to be 1 and 1, but that's something. We have to take care of ourselves. We have to be as cautious as we can for ourselves within reason. But when you look at a message and it's confusing, maybe dig a little deeper and say, well, what might be this person's motivation in telling me this? And then you start also, and then, and just to make a point about being wary of these people who are claiming all these miracle cures, it's the same. I mean, you believe those as much as you believe the flat tummy tea models on Instagram. That stuff, if there was one magic,
I got it.
There was a magic cure, if this was what worked, then that would be what would be happening. You guys have to remember that coronavirus is not only in America. Coronavirus is literally all over the world. And so if one person knew the cure, then they would have done the cure somewhere else and we'd know about it. So I think we all want to believe that there is a cure, and we all want to believe that there's a way to get out of this without us having to just keep going through and trucking through and doing what we don't want to do. But right now there isn't, and we have to stay the course. I sound like now, but we do. We have to stay the course.
I want to bring up something very important, because the whole trust issue, and it has to do with something very fundamental to medicine. There's not a lot of doctors that may look like you in medicine. And these lovely ladies, my sisters in medicine, have come on this forum to hopefully empower our communities in our healthcare. Now, I will tell you, it's not an easy thing to do. And I will tell you that because we all receive the conspiracy theories, whether they're articles, whether they're videos. And what I feel, particularly as a Black female physician, and there are many who would refuse to be on this forum due to the fact that many of our communities of color are more likely to believe some of the potential videos that may be misinformation or conspiracy theory over us. And we don't have the luxury to be wrong. And I say that to say that what we're doing, particularly on this forum, is potentially having a voice, having these, these are, I will brag on them if they are very smart individuals. They are Ivy League institution individuals. And these are things that we normally don't, we did it, but we don't talk about it, right? Dr. Fauci went to the same medical school I went to. So at the end of the day, we are not willing to put ourselves forward because they look at us and say, are you a doctor? How can I trust you? So we're still putting ourselves in this forum, hoping to get a message out to our people that this virus is real. 4 million is not a joke. 150,000 is not a joke.
Yes.
I never want us to even normalize those numbers. Every war, 9/11, these are real people. These are souls that's been lost. And there's only so much we can do. We cannot change who governs us unless we vote, right? So right now we're in a particular situation where the folks that lead us may feel differently. So we got to start making decisions for ourselves. And that may mean us, on three of us, talking to whoever's on to say, look, masking may help you save your life. We may need a community where we have to help one another for the single mother that has to leave her 3 kids at home. She doesn't have the luxury. She has to be at the supermarket to work the next day, the retail store. They're like, if you don't come, you ain't got no job. If you have no job, you pay no rent. If they have no rent, you can't. If you have no money, you can't feed your children. This is where the disparities come in.
That's right.
And I don't know how, this is the realest talk. I'm just trying to be real honest with us. Because I will tell you, many of us who are just as smart, who look like us, don't want to do it. Because they're like, if someone's going to send me that video, what's the point? If they're going to believe that over me.
But this gets back to the collective responsibility that I think compels all of us. And we could have 80 people, 100 people on this Facebook Live. We could have 5, we could have 10. And we would know it was worthwhile with the 5 or 10. Because this is what it's about. This is what change is about. You have to start somewhere. And it starts with us. It really does. And I think all of us are open to getting messages from anyone who's on the call to generate ideas. How do we organize more effectively? How do we in real time make these decisions that lift each other up? How do we inform one another? How do we help my cousin to understand this is not a conspiracy? Like, what can we do? We want to engage in the dialogue. We want to see all of us get to the other side of this stronger. So message us, be in touch with us, and we'll keep bringing the conversations and the ideas to the table, the knowledge to the table, to the best of our ability.
I wanted to also just, before we wrap up, I wanted to talk about how do we empower and advocate for ourselves and our families with all of this. I brought up one point already, maybe using this opportunity to address uh, disparities in like with schools of advocating for a smaller class size and the ratios and things like that. But also if you are going to go talk to the school board or talk to your job, like, listen, everybody's coming to work, they're not wearing masks, they're not washing their hands, they might wear their mask till they get here, but through the day, now everybody's in the office with their mask off. Empowering yourself with actual data when you go talk to the school or go talk to HR and say, look, the numbers in Georgia are this. This is what they're saying is going on. And when you want to advocate for yourself, having concrete information and having a plan for, like, rather than just complaining, like, I don't like this, I don't want to be here, saying, concretely, I think that we should be looking at these types of metrics, or this is something that can be done in this particular school district or at this workplace to make things better for us. I think your voice is a lot stronger when you come with that, one, facts, and two, propose solutions to identify problems.
You have to get involved. I will tell you, particularly in my local area, there is a runoff election for the school board. Now, my oldest, he's no longer going to be in the public school system, but at some point, I would like to take my children out of the private school and place them in the public school because that's what my tax dollar pays for. So guess what? I am voting. You know why? Because the incumbent has made it his business not to be actively involved in the predominantly Black schools that my children would potentially go to. Has done nothing. He does not deserve that seat. So regardless of the fact that I'm in the private school system, I plan to vote. My 18-year-old who's leaving that school system plans to vote, and so does, I'll make sure that my husband does. And they're trying to get the word out. You have to get involved. I am potentially sending my kids back to school. So what have I done? I have emailed my school's principal many a times, and he has personally called me to address every concern I had. Whether it was the language regarding masking. I said, my feedback was encouraging masking was not strong enough. I wanted strongly recommended, because I know that 4-year-olds, if they potentially showed up, they can't control the masking situation. You have to get involved. So when you speak of advocacy, to sit down and say how we're going to do this, we're in front of computers. It's an email. Now you can have a virtual meeting. You don't have to get up and go in your car. They're like, let's do a Zoom. How could you get involved? Because what if we're at this juncture, summer of 2021? Will we still say kids should still be at home for potentially since March of 2020? For fall of 2021? I don't know. So we're having these conversations now.
The last thing I would add is organize and lean on community organizations. There are so many small community-based initiatives that are happening now to get us through this. We see, sadly, a lot is lacking, frankly, from what's coming from federal level, sometimes even state level. This is where we're really seeing the power of nonprofit, local community organizations, churches, boys and girls clubs, YMCAs. Don't be afraid to utilize those resources to reach out. And we said this on our first Defeating Disparities, leveraging the help of your doctors. As a pediatrician, I see this as part of my job. There is no way a parent could come to me with fears and concerns about what am I going to do with my child? I have to work. I don't have proper food at the house. This is the situation, and me not be charged with helping them to figure it out. So if you have nowhere else to turn to your primary care providers. Go to the emergency room. If you're in a desperate situation, like, yes, you're always wanting to gauge your risk of exposure to COVID, but No one wants a mom to be distraught at wit's end with no resources. Turn to your physicians, your care providers to help you, as well as your community organizations, and inherently within that, household to household, family to families. It will be clearer how to organize and how we can get through this together.
And there was one last question I saw about boosting immune system during
Yes,
this
a great
time.
question.
I've been saying the same thing since COVID started. What we should have been doing all along. Overall wellness, exercise, eat right, plenty of water. In terms of what to take, if we're all eating a balanced diet, it's going to have every vitamin that you would find in a pill.
Mm-hmm.
I think that is the best in terms of how to boost your immune system. Are you getting 30 minutes of exercise a day?
Mm-hmm.
And I mean real exercise, heart rate at 95% or above, and that's something that's my zen, that's my peace. I need to exercise. That's a part of me. So those are things that we need to really be during this time while we're social distancing, really trying to actively do. There are home workouts, YouTube. I mean, they got really good videos. If you feel like, well, I'm afraid to go outside because there's too many people and I live in a dense area, there are really good workouts on home videos on YouTube for free. And a lot of gyms are doing them for free. I know my Orange Theory Fitnesses. I saw that, I think Planet Fitness was at one time. So that's really my take on it.
And also getting rest.
Yes.
Your body heals itself when you sleep. So we need to work out, you need to eat well, but you also need to recharge. And I think I might have mentioned this in one of the earlier Defeating Disparities. People, I think, have been very hesitant to take vacation when they're not going into the office. Like, it feels like a waste. Like, why am I going to use vacation days when I'm not going to work anyway? Use them, because you need some time to worry about just yourself. Whether it's like, I want to clean out, I've been trying to clean out that closet for forever, or, even just to have a minute to like refocus and figure out, how am I going to deal with getting my kids back to school, and what is going to be my new business model, because I do need to still go to work and I need to still make money. You need to have some time that you have to be able to focus on things that aren't just your 9 to 5.
Mm-hmm.
All right, guys. So with that, I would like to thank all of you for tuning in for Defeating Disparities. We want to make this a monthly conversation in regards to what is important to us in our communities and how we can help beat this. What tools and resources are available and how we can help get the message out to help and empower our communities, particularly in their healthcare. So myself, Dr. Blake, Dr. Johnson, Dr. Oguntoye, I want to thank you all for a great evening. Thank everyone that's tuned in, and I hope that you are well, masked, social distance, and sanitized, and have a great weekend. Thank you, guys.
Bye.